Hi, everyone. I'm Avon Fire Chief Bob Spur coming to you with one of our regular COVID-19 updates. Joining me as always is,
Kathleen, health agent for Avon.
and joining us today is,
Chris Cadino, Superintendent of the Avon Schools.
welcome. Let's start off with the numbers like we usually do. The known cases in the U.S. are currently at 7,154,000. And by the numbers we use, there are 197,868 fatalities. Some sources have us just over 200,000. That's the number we use for consistency. Massachusetts, we are at 129,243 cases and 9,210 fatalities. Kathleen, how is it locally?
Locally, Avon has 89 cumulative positive cases, and this goes back to the beginning of when we started keeping track of the data. And we currently have 7 positive cases in Avon. So if you've been following our videos, you know that this means that Avon is going to be moved to the high risk or red colored category in the state's new way of color coding all different towns. And Chief Spur can explain further what that means.
Sure, I'll do a little rerun quick for those people that didn't see last week's video. Bring the slide up. So the state uses 4 color criteria. Gray is less than 5 reported cases. Green is an incidence rate or a case rate below 4 per 100,000 over a 14-day period. Yellow is an incident rate between 4 and 8 per 100,000 over a 14-day period. And red is an incident rate above 8 cases per 100,000 over a 14-day period. The thing for Avon that we need to remember, we can only ever be gray or red. To be green community, you have to have at least 9,000 in population. To be a yellow, you have to be at least 4,500. Avon at 4,400 and change can only ever be red. It's not something that makes Avon less safe. It's purely a matter of we're a small town and the math, because of the formula the state uses, just works out that way. It's either gray or red. There is no in between for us.
But I think it's important to point out that COVID is still here. People are still testing positive. We have to be aware of what we're doing, of our actions. When you go out in public, if you can't socially distance, then you should be wearing a mask. All the stuff we've been saying throughout this whole thing.
Absolutely, and I think it's important to note that it's catching, the current cases we're seeing from 20s to 50s. So, there's every age, there's 20, 30, 40, and 50-year-olds all represented in here. What we have not seen yet, although there's nothing that stops them, is we haven't seen kids. And Chris, do you want to talk about what's going on in the schools?
Sure. So as you all know, we started this school year as gray. We chose to the hybrid learning plan. Now, DESE, the Department of Elementary and Secondary Education, has given us metrics that align with the Department of Public Health metrics. And they recommend when a community moves into the red, that you don't use 1 week of data to make any decisions, that you look at multiple weeks and you look at additional data. So currently we do not have any COVID cases in the Avon Public Schools. So we will continue with the hybrid learning model, and we will continue to scrutinize the data over the next several weeks. And I think it's important for our community to know that if one of our Avon Public School community members, either staff or students, test positive, all the families and staff in that building will be made aware of that. They won't be given the name of the staff or student, but they will be made aware that someone has tested positive. Now, if you are a close contact of that person, you will receive further guidance about how to respond to that. So it is a completely transparent process. We need everyone to know in order to keep everyone safe. So as of right now, we will continue with our plan. And safety is always our #1 concern. And I know Chief Spur has had the opportunity to visit our schools, and we really have our schools in fantastic shape. The children have been wonderful, the staff has been wonderful, and we're really fortunate that we're able to provide this opportunity for our students during this time.
I agree. I've had the opportunity a handful of times over the past few weeks. A building commissioner and I, just like we do every year, a couple days before school, walk the facilities. It was probably the most wide open I have seen those rooms in the 11 years I've been, or 13 years I've been chief and doing that. So they look great. I've personally done fire drills with both cohorts, and it's, the drills are done just the way they're supposed to be done, but you've also got staff telling the kids, stay spaced apart. Once you get outside, do the spacing. So I have to commend the schools. You're definitely getting the message across to the kids. The mask wear was fantastic. I saw with all of them. It's going as well as can be expected in our new normal.
Right.
I hate that term, but it's well as can be expected. But I think, Kathleen, the message that we probably need to get back is masks remain important. It's getting on towards a colder time of year. We expect flu seasons. We expect colds. This, in many ways, is no different. It's a respiratory-borne virus. So it's all about that respiratory protection, the social distancing, the contacts. The governor was very clear the other day in talking about the backyard parties and the gatherings of people where there may be alcohol consumed, so your guard is down some. Those are the things we've really got to pay attention to. Kathleen, just very...
Mind me commenting just one thing on that is that we are exercising, we are following the protocols. So there are several times that, students may be sent home from school and when they have a cold or a runny nose, but those were following protocols. They need to be tested or they need to be given another diagnosis by their pediatrician or doctor before they return back to school. So we're being extremely cautious, careful, following all protocols. And I just can't emphasize enough that you will be made aware of that, because I think sometimes assumptions can be made if somebody's not in school or people are sent home, but you will be made aware if we have COVID cases in the schools.
Excellent, excellent. The one other thing that's floating out there, and I know we only want to briefly touch on it, Kathleen, the governor talked about step 2. And right at this point, we honestly don't know what this means for Avon. So it's not going to happen Monday. We're fairly certain.
We don't know. I will be talking to
Yeah.
DPH tomorrow, and I should have a better clarity on what that means for us.
So we plan on filming early next week to, once there's more clarity. We can't really get into that, but I wouldn't book a trampoline party for Monday.
No.
We'll know a lot more prior to that. Other than that, there's not a lot of dressing rooms in town, and there's no performance venues really. So it's something we're aware of. It's being watched, but honestly, the advice hasn't come from DPH on exactly what this means yet. Anything else we want to say, folks?
I would just like to add, if anyone does have questions, please feel free to contact me at the superintendent's office, or the building principals can easily answer any of the questions you may have. So please feel free to reach out to the schools.
Great. And Kathleen, I assume that's the same
for us,
for the health department. And obviously, of course, you need the fire department for something. Everybody knows our 3-digit number. So, it's, folks, you're doing great. We've got a little blip going here, hopefully, and with some diligent mask use and social distancing and just being careful about it, the good hand hygiene, like we should be doing this time of year anyways, we'll get through this. We see, as long as things stay in the right direction, the light is, sort of in the end of the tunnel there for this blip that we've got at the moment. It's going to be a long haul until we have vaccine or effective treatment, but we're getting there. So Avon, stay safe. Thank you for watching us, and we'll see you next week. Goodbye.
Bye.
Bye.